people who have an underlying health condition of any age, and that's a defined list. People should know if they are on that list because they'll have been invited previously for vaccination. But it includes people in whom flu might cause more severe illness than others. So that's diabetes, asthma, heart disease, and so on. People over 65 are also eligible for the vaccine because as we get older, again, the impact of flu illness on us would be greater. Children with an underlying health condition have been eligible for a long time now. For the first time this year, we're rolling out the Healthy Child Flu Vaccination Programme, which will offer flu vaccine to all children between the ages of 2 and the end of primary school. And then on top of that, DHSC frontline health and care workers are also eligible for flu vaccine.
And do those vaccines differ group to group? Does a child get a different vaccine to someone who's over 65?
Yes, the children get a nasal vaccine, drops in the nose, which is a live attenuated vaccine.
And has there been, I know with the kids' vaccines, for example, I know that letters went home to parents a few weeks back. Has there been a big uptake?
It's not being offered yet. The letters went out to tell them that it would be.
And are you expecting there to be more interest this year, given everything that's been going on health-wise this year?
I hope so. Obviously, uptake of flu vaccine is important in any year, and we mustn't forget that actually the excess deaths that happen from flu, even in a normal year, are around those that we've seen from COVID. So because COVID is a new disease and therefore is very much in the front of our minds, it's important that we don't forget the impact of flu, which has been around obviously for very much longer.
I know certainly in the UK the advice has been very much get your flu vaccine because if you get flu and coronavirus at the same time, it's really not a good combination. Is that something you would agree with?
That is absolutely true. We are in the extraordinarily fortunate position at the moment that we are COVID-free on island, and our risk of COVID comes not from current community transmission but from imported cases, which we hope to be able to keep under control. But even allowing for that, flu in itself has significant impact. So people should make the decision about the flu vaccine primarily because of the benefits around flu, but also for the added issue that you've just outlined, that if you were unlucky enough to get a double hit with flu and COVID, the outcome is likely to be very much worse.
Given that there is an added emphasis this year, will there be enough stocks? Is there going to be enough to go around?
We anticipate so, yes. I mean, we're part of the procurement and distribution system for the British Isles, for the UK. Not the whole British Isles, because Ireland has their own system. So we will get our allocated share within that. It's probably worth saying on that issue that it is hoped that we will be able to extend the flu vaccine to healthy people in the age group 50 to 64. Already a lot of those people will be eligible under one of the existing programmes if they have a pre-existing health condition or they're a frontline worker. But we do hope to be able to extend it to others. However, it's very important that people in the risk groups get their vaccine first. So it won't be until later in the year that we will be able to know whether there is sufficient supply to roll out to the healthy 50 to 64-year-olds.
So if you don't have a vaccine and you start getting symptoms, throaty symptoms, maybe a bit of a sniffle, how do you know what that is? Whether it's a cold, whether it's flu, whether it's coronavirus? What's the difference?
Right. Firstly, we have the issue that currently on island we have no circulating coronavirus. So the likelihood that any symptoms are COVID is very, very low. That's called the pre-test probability, to get technical about it. In terms of the symptoms that are most strongly associated with COVID, they remain as they have been for some considerable time now. Well, considerable time, it's only about 6 months we've had the whole thing. But increasingly, the headline symptoms are temperature of 37.8 degrees or higher, new onset continuous cough, which means 3 or more bouts of coughing in an hour or sustained bouts of coughing across 24 hours. and then a change in your sense of taste or smell. So if your predominant symptoms are runny nose, sneezing, tickly throat, sore throat, those are not primary COVID symptoms, so you really don't need to be worrying. Anybody that is worried about symptoms they have, or particularly if it's a child with symptoms, because ill children are always more of a worry, then go to the COVID online assessment tool and do that. And if the tool instructs you to do so, contact COVID 111 for clinical assessment and advice.
We know that there has been a lot of symptom variation person to person, so how do you know when it's time to isolate?
Again, it's going back to those headline symptoms. If you've got a runny nose and a tickly throat, what can you say? It's best not to be passing around respiratory viruses anyway. So any symptoms and you're unwell, stay indoors, stay away from people. Do that with flu. We advise that every year anyway. All of these viruses pass from person to person. That's the predominant mode of spread. And therefore, the more you can keep away with other people, from other people, whatever the virus you're likely to have, the better, really.
It is the time of year when we do start to see a lot more of these types of virus anyway. Is there a worry that the testing system on Ireland is going to be inundated?
The testing system, the 111 system, COVID 111 system, is designed to build in clinical assessment. So if people are ringing up to say, they've got a runny nose, they're sneezing, they've got a tickly cough, maybe a bit of a sore throat, maybe a bit of earache, that will likely, having gone through the careful clinical assessment, result in them being reassured rather than being invited for a test. So we shouldn't be inundating the testing system. We are lucky to have spare capacity at the moment, so we anticipate that we should be able to manage things without overwhelming the testing system. We don't fear that we're going to see a rerun of what is sadly happening across, so we're in a very fortunate position on that one.